Welcome to another edition of A Lot of Help with James Lott Jr. I am James Lott Jr., of course, here at JLJ Media. This is the show where we talk to people about medical issues that also can help you in your life. Of course, I'm a former nurse myself, so I love talking things about medical stuff, and I love advances on kind of things that go on. And if you ever wore heels, which I know a lot of women who do, and some men in drag, it's bad on your feet. It is not good for you. I've watched my late grandmother who wore heels her whole life. One day I saw her feet, I was like, oh my goodness. So we have someone, we're going to talk about this, about how it's going to be hard on your feet, your ankles, legs, that kind of stuff, and what's going on in the world of platform heels and how that's going to work for you out there. So help me welcome top medical, let's make sure that's right, top orthopedic surgeon and sports medicine specialist, Dr. Andrew Dold. Hi, doctor.
How are you? Thanks for having me.
My pleasure, actually. So I was just saying in the beginning, I know a lot of women, especially of certain generations, who wore, heels every day, all the time when they left the house. And then, of course, there's certain professions like modeling and things like that, where actually heels are very common. Let's talk about how wearing heels over time can really mess up a lot of stuff in your legs and back and ankles. Let's talk about that for a little bit.
Yeah, I mean, high heels aren't the most supportive shoes in the world. I think that goes without saying. There are a number of factors to consider with wearing high heels. Probably the most important one is, well, there's a couple I would put at the top of the list, but number one, the narrow toe in most stiletto type shoes. And secondly, the lift at the back on the heel places the ankle and hindfoot into a plantar flexed position, or equinus. Equinus being like a horse, if you think a horse walking like that. So it really raises the heel. That can lead to shortening of the structures in the back of the leg, like the calf and Achilles tendon, and lead to conditions like Achilles tendonitis or plantar fasciitis, things that are associated with having stiff muscles and tendons.
Yeah, my mother has that plantar fasciitis, so she wears special things now for that. Actually, explain exactly what that is. I know a lot of friends who are getting that actually, and they're like, "What does that mean?" Actually,
plantar fasciitis.
Yeah. Please explain that.
Yeah, so the plantar fascia is a piece of fascia. Fascia, I explain to my patients, is almost like a sort of leather-like substance. If you think of a piece of leather like a leather belt that runs throughout the base of the foot, from the hindfoot, the heel, to the forefoot, the toes. And it supports the arch of the foot, the longitudinal arch of the foot. Now, in terms of a pathologic standpoint, this is something that can become inflamed. And when it does, we call it plantar fasciitis, or inflammation of the plantar fascia. There are a number of important causes for this, but I think when it comes to, stilettos and things like that, it's probably from prolonged use of people putting their foot into a plantar flexed position, which ultimately will lead to shortening or stiffness of the Achilles tendon and calf, which affects the whole aspect of the distal aspect of the leg and then also into the foot. So you can't really think of plantar fasciitis as a sole problem that's primarily caused simply by disease to the plantar fascia, but rather think of it in context of the entire posterior aspect of the leg, starting with the calf muscle behind the knee, down into the Achilles tendon, which attaches to the base of the calcaneus bone, the heel bone, which leads into the plantar fascia in the foot. So if any one of those things becomes tightened or constricted, along with repetitive exercises or routines, you can lead to inflammation of the plantar fascia.
How, there's a whole thing of, well, for beauty, pain for beauty. Women are taught this, pain for beauty. And yes, it does. Things do hurt. And of course it hurts when you wear heels. And I've worn heels a couple of times at Halloween's here and there. And it is not, I got some hooves.
I'd like to see you in a pair of heels.
Woo, I got nice legs, doctor. I got some hooves. I wear a size 14 shoe. I'm a big boy. So I'm not a pretty in a sense, but I have nice legs. But wearing heels, for me, it was just for a minute, for like an evening. I'm just like, I don't know how women do. I don't know how women do this. But the whole point is, a lot of women are told there's always pain associated. So when do women, or anyone who wears heels, say anyone who wears heels on a semi-regular, regular basis, when you have pains, when do you go to the doctor to see if it's anything more? Because you're taught there's always pain, but like, when do you actually go, there's something going on here, I should go get checked out?
Yeah, I think, I mean, when if you're having maybe some discomfort while you're wearing the high heels, the stilettos, then that's one thing. But I think if this becomes problematic when you're wearing, running shoes or tennis shoes, more neutral based shoe, if you're having pain then, or maybe pain when you go to sleep at night, then it's maybe time to consider visiting a doctor.
Okay, actually that makes sense. Okay, that makes sense. Like, you go back to your regular life when you're out of the heel,
Yeah.
and it's like,
Yeah.
it's bothering you. No, that makes sense, because you know what I mean. Like, women are sometimes taught, well, this of course is going to hurt. This is how it is. We just sit and grin and bear it. That kind of thing. It's like, well, no, maybe something serious is going on there. Just in case. Now, should people go to a foot doctor, or should I go to their doctor at first? And usually that's, and see, a busy doctor, you guys. Doctor.
Right. I mean, I would probably say that it's good to start just with your regular doctor.
Okay.
They can direct you from there. Most, family physicians have some experience with typical tendinopathies, conditions like this. So I think that's probably a good start. If it's a little bit more serious, they might refer you to a foot and ankle specialist, or maybe a sports medicine specialist for another opinion, or maybe some more investigations.
So, doctor, how long have you been doing sports medicine and orthopedic stuff?
Yeah, so I mean, it depends if you take into account my training. So you do typically 5 years of orthopedic surgery residency training, and then a fellowship after that. So my fellowship following orthopedic surgery residency was a fellowship in sports medicine. And then I've been in practice after that for about six or 7 years, I think now.
Yeah. Why feet? Why the foot for you?
I mean, the foot is just part of my practice. So I do hips, knees, shoulders, and the foot. The foot is something that is, commonly affected in sports and things like that, whether it's the Achilles tendon or the plantar fascia. Everyone's on their feet all day, every day. So it's a common source of injury. So I think as an orthopedic surgeon, you have to be well equipped to deal with common foot injuries.
Well, I'd figure the shoulders, hips, it's all connected. I mean, I had rotated 2 discs out of my back years ago. You know what I did, doctor? This is how I wish it was a sports thing. I wish it was something I did that was extraordinary. It was, I got out of bed too fast and stepped down wrong. Well, I was like, wait, because I remember the day I got up and went, ow. But I had to fly cross country. Oh, that was the dumbest thing I ever did. I know what was going on. It kind of hurt a little bit. I'm like, oh, I can do this. I limped a little bit at the hospital. Got on a plane to fly to New York from Los Angeles. That's a 4.5 hour, 5 hour flight. It was direct. I wanted to kill myself after hour 2 on the plane. So I was not comfortable, and it was kicking in. And I went to the doctor once I got to New York. But it's funny, like, I just stepped out of bed, and all of a sudden it was like L4 and L5 just rotated out or whatever. So they had to. I realized at that moment, and all the PT I did afterwards, how much all this is all connected.
Yeah.
I went to nursing school and I was a nurse, and I knew this, but I actually literally felt how all of our body, it's just strands of stuff, isn't it?
Sure, everything's connected. You're right. So did you have surgery on your lumbar spine?
No, I didn't. They said they determined that with physical therapy for 6 months, and when they were in my back and they were rotating and they were massaging in, that actually went back in. I lucked out. I didn't need any surgery, thank God. So I was like, I didn't want to, because I hear about back surgeries. I'm like, oh, I don't know about that so much. So I just made sure I was careful on how I did things, but it was just stepping out of bed could literally do stuff to you.
Right.
Okay, so now you said there's these shoes, because we know about orthopedic shoes in other ways. We hear about those kind of things, but now you're talking about something slightly a little different. It's a shoe that's a platform heel. So let's talk about that. Like what we come up with that?
Yeah, so I mean, I'm not too familiar with these shoes myself, but the platforms seem to be the latest trend in women's fashion these days. I mean, aside from the obvious risk that you're walking on a platform and you've got to be careful about maybe tripping over a curb or something like that and simply falling and injuring yourself or twisting your ankle, I think in terms of like the hindfoot pathologies that are usually associated with stilettos, probably a little bit safer than stilettos in that sense.
I was going to ask you that if it's safer or not. You think? I mean, I'm thinking,
yeah, the foot's in a more neutral position, not in a plantar flexed or equinus position. So I think probably a little bit safer for preventing Achilles tendonitis, plantar fasciitis, things like that.
Yeah, I know some people who are doing chunkier shoes too. There's a chunkier heel seems to be coming in too. So I'm thinking for the foot position, it must be, because now look at this, now you're right, look at the foot position. As long as they're not doing this, I guess, if they're doing a little more level, it's better, I guess. Is that what it is?
Yeah, I think you've hit the nail on the head there. I think it's a little bit better for you.
So let's see, I was curious. Now, but you can also hurt yourself when you're wearing tennis shoes too, right? You still.
Yeah, of course.
Yes.
I mean, no shoe is sort of free from risks of, rolling your ankle and injuring it that way. That's a given. I think one way, back to what you said in terms of position of the foot, you've got to think about the treatment for some of these conditions. And one of the treatment modalities for plantar fasciitis, what we talked about before, is night splints. And basically what this is it's a splint which flexes the foot the opposite way of a stiletto, and it positions the foot in a dorsiflexed position to try and stretch the plantar fascia and the Achilles tendon and calf. And you put these on before you go to bed at night. So, you're in bed for maybe 7 or 8 hours, and it's like a 7 or 8 hour stretch trying to treat the condition. So if you think about it that way, the treatment is actually the opposite of what your foot would be in if you were in a high pair of stilettos.
I have flat feet, so I had to have orthotics made. That's a slight arch in there, and now because my feet would always hurt when I was standing long periods of time. I had jobs back in the day when I was doing, being a waiter or retail. Like you stand all day long. You don't sit. You stand all day long. I'll tell you, folks. Once I got the orthotics, it did help my life. It did change it a bit. And I heard this other thing about yoga. I was taking yoga for a while, and they're like, "You do enough of these, you'll get an arch in your foot." So I would ask you, doctor, is that true? Or are you just saying that over there?
What, you got to arch your foot?
They're going to go after a while from doing yoga that you can gain an arch of some sort. Not a high one, but you can gain one. I'm like, is that true?
That would be news to me. I don't think that's true.
Oh, it is easy. I just heard that.
Yeah.
I talked to a guy on feet. I was like, I don't know if that's true or not, but I said the orthotics have helped me kind of support my foot the way I was going. I had a friend who had a super high arch. They had to get orthotics to even it out.
Yeah.
He said, because he was walking like a Clydesdale, he said, or something, the way he was walking. He mentioned horses earlier. They said he was walking a similar way, and it was hurting his back and front.
Yeah, I mean, orthotics can be used for all different types of people, all different types of arches. But yeah, flat foot, that would be something that you might want to look into, is getting a good pair of orthotics, as you explained to us. Can certainly help.
Yeah, and I also found some shoes that have memory foam supports too inside. I've also found that actually can help a little bit too.
Awesome.
I like to walk. I've done marathons. And
whatever works.
It's nice, but the foot is. The foot is very important, isn't it? I mean, for obvious reasons, we need to stand and walk. But it really is. Would you describe the foot as a delicate thing or as a resilient piece of our body? How would you describe the foot in terms of that?
I mean, I think it's pretty resilient. You're on your feet all day long, and for the number of patients that present with foot problems, it's pretty small in comparison to how much we use our feet, I think. But obviously, you got to take care of them. This is, as you sort of allude to with your back, you don't know what you've got till it's gone, kind of thing. Once you have a bad injury around your foot or your ankle, it's a life changer.
It is. Now, apparently, you were also named in USA Today as one of the top doctors, $40 under 40 in America once. So, I mean, come on, doctor. There's a million doctors out there, right? There's a million out there. So how'd that feel? I mean, that's like, congratulations. That's a nice thing. I mean, there's a lot of doctors out there.
Yeah, thank you. How did it feel? It felt pretty good, I guess. I mean, I don't know who's picking those lists, but maybe it's an indication that we're doing something right. So try to just work hard and take good care of my patients and do the best job that I can. And maybe I'll be on the top doctors over 40 one day.
I love it. Where's your practice out of?
We are based just outside of Dallas, Texas, in Frisco, Texas. It's about, call it half an hour north of Dallas.
Yes, I have a cousin who lives there in Frisco. But I mean, why I bring that up is that you're in here in the trenches, just doing the work. I'm sure you're just minding your own business, doing your practice, taking care of patients, and it's like this does come up. And to me, out of all the doctors, I mean, whoever's putting these lists here, still it's a great accomplishment.
Yeah, well, thank you. I appreciate it.
So what, as we leave you with this, what do you want people to take away from this whole thing with the feet? Like, what would you like to leave people with in terms of the feet?
Yeah, I mean, I think we've discussed a few points, but you got to take care of your feet. They're particularly important, especially for people that are on their feet all day long. But I mean, everyone, no matter what you do for your daily job or whatever it is, you need your feet. So to take good care of them. If you're wearing stilettos every single day with a very high heel lift, and you don't switch or moderate how much you're wearing those stilettos, you may succumb to certain pathologies like Achilles tendinopathy or plantar fasciitis are two of the things we talked about. So I would suggest maybe, if you have a long day in stilettos, getting home and doing some stretches for your calf and Achilles, maybe your plantar fascia, and maybe just intersperse wearing those types of shoes with a tennis shoe or something that keeps the hind foot in a neutral position rather than a highly plantar flexed position.
And does soaking your feet do anything?
Sorry, say that again.
I'm sorry, does soaking your feet do anything?
Soaking your feet does not do anything for the muscles and the tendons, I wouldn't say. Obviously, for aesthetic reasons of dry skin and your nails and things like that, I'm sure it does, but I wouldn't say that that's any sort of a treatment for like Achilles tendonitis or plantar fasciitis.
I'll make sure I ask, if people always ask me, well, I'll just soak my feet. I'm like, that's...
might make them look better, but I don't think it's going to do much for any other illness.
I mean, like nice looking feet too. It's good. So you can soak your feet for aesthetics, folks out there. I'm not saying don't do it, but any more serious than that, go to a doctor.
I would agree with you there.
Thank you, Dr. Andrew Dold, for being on the show.
My pleasure. Thanks very much for having me. This is great.
It's my pleasure. And I'm James Lott Jr. here on A Lot of Help. And you go to lottofhelp.com for more information on what I do. Also, we're here at JLJ Media. So we have over 45 shows. We have more of these shows out there. Pass this show along, this episode along to anybody you think need to hear this and need to see this about their feet. So pass it on to them. Please do. Everyone, please have a great day, and we'll see you next time.